Hey there everybody, it's Dr. Steve with Kinesi, and here is your part 2. Start your healing now for low back pain in a facet joint impingement or a compression. So in part 1 we started with some motion is lotion, lengthening, opening up the joints, and we did a hamstring stretch with the hands down and wiggling and opening up the spine. And then we did this opposite side lateral banana stretch and opening things up. So now we're going to take it into a little bit more of a dynamic exercise. This is a muscle activation, and we're turning on those joints as we're going through everything. So what we're going to do here is we're going to use the chair seat as a target, and we're going to do some reaches in the 3 directions that we always go: a forward, a side, and a rotation. So we're going to do our 1 foot forward, 1 foot back position, and we're going to start with a forward reach or anterior. The butt drops into a squat motion, and then the hands reach out to touch the target. And so as we get into this position, it's turning on glutes and hamstrings, it's lengthening through the spine, and we're opening up those facet joints on that side as we're reaching. So you want to stand tall in between each one, but you're dropping into a squat and reaching the hands out to touch the target. The hands are going to take the trunk and take that in a certain direction. The trunk is connected to the pelvis, and so that's going to be part of that lengthening through the system. So we have the left foot forward, and we were just doing the reaching forward. We're going to stick with this pattern of the left foot forward, and we're turning the body 90 degrees. So now we're going to do the side reach, and this one is called opposite side lateral because it's referencing the front leg. Front leg is the left one, so I'm going to be reaching to the opposite side, the right. But now the target is along the side of my body, so the butt goes back into that same squat. The hands reach to the side to touch the target just outside this back leg. Standing tall in between each one. And that's the side reach, opposite side lateral. Now, we're going to stick with the pattern. Left foot stays forward for the moment. We're going to turn another 90 degrees. So now the target is behind me, and we're going to stick with this. It's called opposite side rotation because the opposite word is referencing this front leg. We're rotating around the corner to check the seat to make sure it's still there, and then somebody didn't pull the seat out from underneath you. And we're sticking with this pattern. We're reaching around the corner of this back leg. That's why we call it the opposite side rotation. So reaching around the corner, check the seat, make sure it's there, stand tall in between each one. So now we repeat that with the right foot forward. So now we've got the right foot forward. We're going to start with the forward reach. Butt drops into the squat. We want it to be a little bit of a stretch to get there, but you're not supporting yourself and pushing off. So it's not a catch and release, but it's just a tight little or light little touch. So squat, touch, stand tall. After the forward ones, we turn 90 degrees. Target is along the side of my body. We're going opposite side lateral. So the body drops into that same squat motion. Hands reaching across the body to touch the target out along the side. Standing tall in between each one. And then we do our one more 90-degree turn. Target is behind me. Reaching around the corner of the back leg to touch the seat. Make sure it's still there. And standing tall in between each one. So there we have part 2 of our little series, Start Your Healing Now for Low Back Pain and a Facet Joint Compression. Be sure to stay tuned and look for part 3 where we'll take it just one notch further. And And as always, if you or anybody that you care about is struggling with some pain, don't let them suffer. Send them in. Let us help with a plan, a direction, and some hope. So until next time, bye-bye everybody.